I saw my patients. I'm back just for this.
Mine is completely opposite. I start my work at 4 and then it goes up till.
Just a minute, ma'am.
Okay.
I'll introduce starting, then you can go on. Yeah, we are live now. 1 minute. A very good evening to one and all. This is Dr. Nagaraj from IIP Digital Media Team. So from today, we have meeting on effect of prolonged sitting on spine, ergonomics, and management of low back pain. So over to you, ma'am. You can please continue.
Thank you, Dr. Nagraj.
Hello, ma'am. Can you hear me?
Yes, you can hear me?
Yes, you both are audible.
Yeah, ma'am. Please start.
Good evening, everyone. This is Dr. Urvi Katakia, the coordinator of West Mumbai District. A warm welcome to this special webinar organized by the Indian Association of Physiotherapists, Women's Cell West Mumbai District on the occasion of World Physiotherapy Day. Today we are celebrating the crucial role physiotherapists play in enhancing health and well-being through movement and rehabilitation. This year's theme underscores the importance of physiotherapy in maintaining physical health, highlighting its importance in low back pain. We are honored to have with us a distinguished guest speaker, David Friedberg. He is a highly experienced physiotherapist who has made significant contributions to the field. Sir's expertise spans various areas of physiotherapy, and his dedication to improving patient outcomes is truly inspiring. We are excited to hear his insights and knowledge as he shares valuable information with us today. Without further ado, I would like to welcome Dr. David Sir to the webinar. Sir, you are please welcome.
Shukriya. Thank you, everybody, for having me today. Namaste. Satsiriya Kal to all. Ab kese ho kem cho. How is everybody doing today? Thank you for having me. First, before I say anything, I just want to say thank you so much to the Women's Cell of the Indian Association of Physiotherapists and the entire organization of the Indian Association of Physiotherapists. Thank you for inviting me to speak with all of you today. I am truly grateful. And it is an honor to be here to speak about World Physiotherapy Day. For those that may not be in the know as to who I am a doctor of physical therapy in the United States. I work out of New York. I am the course coordinator for NPTE Final Frontier, which helps prepare students within the US to prepare for that NPTE, whether it's for the PT or PTA. In addition to that, I am on the board of directors for the Foreign Academic Credentialing Tools and Services to help students that are internationally educated PTs practice physical therapy within the US. So, thank you very much for having me here today.
Wow, that is really impressive, David. I'm really honored and privileged to be here talking to you today. And I thank IIP, Indian Association of Physiotherapy Women's Cell, for giving me the opportunity to, start this session. So without any further ado, I'll start with my first question to you, and that is, how important is posture in preventing and managing low back pain?
So that is a great question that I think everybody, all of these questions that we're going to be diving into, I think are very important to assess. So first off, what is low back pain? I think that is a key thing to know. So low back pain is defined as pain in the area between the lower margin of the 12th rib and the inferior gluteal folds. So I am sure all of us, after sitting for a very long time in the clinic or when we're studying and reading books, have been feeling that way, especially all those students out there. I think it's important with for posture and the preventing of the low back pain. It starts with awareness. And this may overlap with some of the questions that we're going to be diving into, but awareness is such a key for preventing that low back pain because you have to be aware of your posture when you're sitting in a chair for a prolonged period of time. When you are lifting something, posture is key. You can't just bend down and pick it up without bending at the knees. You can't just bend down and lift, and then let's say you want to put your groceries on the countertop or something. You can't just bend down and lift and twist. That lift and twist motion is going to put you at such a high risk of potential disc herniation. So even that, the PT, that patient education, is an important key for preventing that low back pain. So I think that is very important with in regards to your posture, whether it's just sitting in the chair or in your body mechanics of what your normal day activity is.
Okay, that was an amazing answer. My next question for you would be, can you explain the role of physiotherapy or the physical activity that is needed and exercises, both in preventing as well as treating the low back pain? So what's the role of activity and exercise both?
Of course. So as we know as physical therapists, activity is important. Guess what? I'm so sorry we cannot just stay in bed all day. I know sometimes it would be great. I've been there before where you wake up and you're like, I do not want to go to work today. I do not want to get out of my bed. I just want to stay in this bed the entire day. I'm sorry, you cannot be on bed rest. You have to get up and about. And that goes the same thing with sitting in a couch or in a chair for a prolonged period of time. And it's important to also verbalize this to your patients. You can't get comfortable with being sedentary. You have to be active. You have to be out there. You have to be moving because every single thing that you end up doing throughout your day, you're also strengthening your muscles. Even just by walking, you're strengthening your legs a little bit, right? You're getting that activity, you're getting the blood moving. And all of that is going to actually help out preventing low back pain. That movement, that prevention of just remaining in one position for so long. Also, when you're actually getting those exercises in there, I think exercises such as strengthening, but also stretching is key because when you're sitting there sedentary, you're going to have some muscles getting a little bit weak. You're going to be having some tightness in the pecs. You're going to have to get those stretches out there. So, guess what? Stretching is going to be just as much of an important point as strengthening when it comes to low back pain. So, I think it's very important to know those stretches and know this strengthening. Having core strength is very important as well. Strengthening the abdominal muscles. So do your sit-ups, do your crunches, do posterior pelvic tilts. All of those exercises are going to help you out. And I think that all together, it is going to be beneficial for you and your patients because at the end of the day, you have to be able to assist yourself before you assist any patient. So if you are sitting in a chair for a long period of time, or you just don't want to get up and do the exercises, how do you expect your patients to do that? You have to. It starts with you, and it starts with you taking action. So don't get comfortable, get those exercises in there, get the strengthening in there, and your low back pain is going to start to fade away. And I think that treating it is very important too. You have mobilizations, spinal mobilizations that you can do. In addition to that, sometimes, as we mentioned, the strengthening and the stretching, but also modalities can help as well. My favorite modality, I know you can do a moist heating pack or even a cold compress. I always love to apply for patients. I like a cold compress because a lot of patients don't understand, and I think you have to explain to them the difference between heating pads and cold compresses. Heating pad is going to be a vasodilator. So all of the vessels are going to be opening up a little bit more, causing more blood flow to the areas, right? Which could actually cause more inflammation as well. So, as opposed to that, cold compress, it's a vasoconstrictor. So all of those vessels, now they're going to close up. And that's going to help reduce inflammation to that area. So in a patient or each other, after a long day of work, using an ice pack on that low back, that could help out a lot. But remember, that's only a modality. You still have to do the exercises, the strengthening, the stretching, and that's how you are going to prevent that low back pain, but also steps to getting better from that low back pain.
Wow, that is really very insightful. But David, in today's world, everybody is phone freak. Even if somebody needs to take a break from a bigger screen, they would go back to their small screen and take a break. So all of these postures and maintaining or being in that posture for a longer period of time is creating a lot of low back pain in young adults as well. Talking about young adults, you know, how about the lifestyle factors like our diet, our sleep, or the stress that we have can impact low back pain?
Oh yeah, I totally agree with you. And unfortunately, the entire aspect of everybody being on their phone, right? Everybody is just you end up like this, bad posture, slouching. I see it every day too much in the clinic where a patient may be coming in for low back pain or let's say a total knee replacement. But sometimes I'll take out the phone and they'll get on the phone. So it's not even the younger generation too. It's the older generation too, the new generation, the present, the past. Everybody is doing it now where you observe anybody and they'll be sitting there. Once they take out the phone, they go right into that slouching. How many times do we tell our patients for even neck pain to lift it up, right? So many times we say, lift up, bring it to at least eye level. And what do? You tell them, and then they slouch again. Well, with that neck pain, you're going to end up having that low back pain and everything. So I definitely see that every day. I think lifestyle wise, as you were asking before, something that goes along with sedentary lifestyles is also avoiding obesity. I think that the increase of that weight on the joints can be very damaging, not to mention that other contributing factors that can go along with poor dieting. Um, Sleep is going to be very beneficial because you need that time to recover. Your bones, your muscles, everything needs time to recover, and the stress impacts those joints. The stress is going to impact all of that and cause more damage. And it's actually interesting because one of the most common causes of disability in high income and middle income nations is the low back pain. So I think it's important that we address that. Physical inactivity is one of the most important behavioral risk factors for mortality worldwide. And it's been proven that that's the same not just with one age group, but across all of the age groups, that low back pain and that association. So exercise completion and adherence is key. You can give somebody exercises, strengthening, stretching, but you have to adhere to it. You have to do it constantly. You can get started, and I'm sure all of us have started something and said, I'm going to hold off on that right now. Maybe it's yoga, maybe it's anything, maybe it's just even studying, where we say, well, or reading a book. So you can start a little bit, you can get right in there. But then after a little bit, you start to die off. You'll start to make excuses why you can't do it. Why can't you read? Why can't you strengthen? Why can't you stretch? Why can't you work out? Why you can't do things? And you start to feed into all of those why you can't do that activity. You have to take action. You have to snap yourself out of it. You cannot get comfortable with that mindset. Because if you keep on finding excuses why you can't do something, such as those strengthening and stretching exercises, preventing that low back pain, having a proper diet, when you start to find those excuses and buy into those excuses for yourself, the only person that you're hurting is you. And you deserve better than that. You are incredible. You are all here for a reason. You are all meant for so much. So why treat yourself with so much lack of respect, with so much lack of thought or care? You have to adhere to those exercises. You have to strengthen. You have to stretch. You need to, especially in regards to preventing that low back pain. And when you have back to the obesity, It's been shown that higher BMI is associated with a higher risk of developing that chronic low back pain. So, all of these things, it could help reduce you from going into a higher BMI level. And musculoskeletal symptoms in that low back, that could be ranging from other body segments as well, such as your neck, your upper back, your shoulders. All of it will play factor. So, your lifestyle choices do matter. Okay, sometimes you may want to sit there and take a day off. Sure, go for it. But you can't adhere to that day off. You can't adhere to that lifestyle of not doing exercises, not being active, not taking care of yourself. Your body is important and so is your mind. So guess what? When you're being active, when you're changing that lifestyle, let's not just talk about the low back pain, even though I know that the low back pain is the key topic, but it's also important mentally, right? Psychologically. It's very important to get those exercises out there. It's in there. It's very important to do right for you. It's very important not to just stay seated all day. It's very important to go up there, to wake up and go get your day going, because mentally it is going to help you, as opposed to just sitting there and thinking that doom and gloom and not wanting to do your exercises, not wanting to improve yourself, not wanting to improve your lifestyle. So sometimes when working with yourselves and also your patients, you have to start up here too. So that's where I think patient education is very important. And listening to your patients, and listen to yourself too. You have a lot to say. Listen to yourself. So I think that patient education is very important because you also have to explain to that patient, including yourself, why it is so important to watch your diet, have good, healthy habits, not have a sedentary lifestyle. If you're having low back pain, address that low back pain. Why are you having that low back pain? What are you doing to contribute to that low back pain? But what are you doing to prevent that low back pain? What are you doing to assist in that healing of the low back pain? So I think lifestyle plays a huge, huge important factor with everything contributing to that low back pain. So to come back to the question, you got to take care of yourself, take care of your mind, take care of your back.
Thank you, David. That was a very holistic approach, and that's what most of us physios try to implement clinically to, integrate the mind and the body when it comes to healing, whether it's low back pain or any condition for that matter. It's very, very important to keep that balance between your sleep pattern, your diet, as well as your stress levels, and most importantly, your physical activity. This leads me to the next point and the next question. We do know that a lot of people have switched for work from home module during the pandemic, and some still continue to have a hybrid work kind of a culture in their offices, which means that majority of people tend to sit for at least 6 to 8 hours a day in their workspace at their desk. And this is resulting into a lot of spinal issues, especially low back pain because of prolonged sitting. And sadly, most patients are not aware about ergonomics. They're not educated, or, they do not know the right manner in which you keep the top of the screen at your eye level, or maybe just keep a lumbar support when you're seated during your working hours. So could you please enlighten the audiences as well as other physios around the globe about the role of ergonomics and how useful it is in preventing low back pain, especially for people who have desk jobs most of the time?
Of course, I'd love to. And I think, as you mentioned before, with a holistic approach, that is so important. And I think everybody globally can benefit from more of a holistic approach to everything because your mind is a key factor to so much, to everything taking place within your life, your lifestyle, and how you're going about your day. So that holistic approach is very important. But ergonomic wise, I know everybody during that the awful pandemic and everything, everybody got so used to working at home, and now more people are working at home. More people are, as you mentioned, are working longer hours at home. And it's not like you're working and sitting for a short period of time, 15 minutes, up and going, up and going. You're staying seated for a very long period of time. Something that you mentioned that was very important, that lumbar support pillow. a lumbar roll, that can help you out so much because I don't know how many people have utilized that before, but you just put it in that low back and automatically you may be after a long day typing like this, feeling this slouching, and then you put that back there, automatically it's going to prompt you to get upright, shoulders back, chin up, and that's going to help a lot. So invest in a low back lumbar support pillow. And guess what? If you can't afford a lumbar support pillow, there's other things out there, like a Bounty paper roll, where you can just utilize that. If you can't have a pillow or even a regular pillow, use a paper roll and just shove that behind your back. Easy way to compensate and utilize. Ergonomic style with the workplace, there are so many important things that you have to utilize to better yourself. Some some big tips: elbows. You want your elbows to be bent at a 90-degree angle. So these are all going to be tips that you can utilize within your own workplace when you're working there for a prolonged period of time or a short-term period of time. So elbows bent 90 degrees. Maybe your chair is very low, or maybe it's really, really high up and it's preventing your elbows from being at that 90-degree angle. See if you can change that chair height. If, let's say, you are unable to change the chair and it's a stationary chair, stick some textbooks or something underneath you. Give yourself some sort of a platform that you can sit on to get that 90-degree angle in the elbows. Your wrists. Your wrist should be in a neutral position when you're at a computer or when you're working. You want to be at a neutral position. So they do have devices that you can purchase online to help you out with that. But make sure that your wrists, they're not bent or anything like that. As we know, the bending of it may not influence low back pain, but I know everybody knows something called carpal tunnel syndrome. So I know a lot of people with the workplace and ergonomics are starting to build up carpal tunnel syndrome as well. So that carpal tunnel area is going to help out from maintaining a neutral position. In addition to all of that, your hips and your knees should be flexed at a 90-degree angle as well. As I mentioned before with the degree of your elbow flexion, 90 degrees, hips and knees 90 degrees too. Once again, adjust the chair where that's going to be beneficial for you to hit that angle. Make sure that your ankles and your feet, that everything, you're grounded. You're touching the floor, you're touching the ground. And I know holistically, being grounded is very important too. Have your feet on the ground. If your chair is way too high for you, see if you can lower it. And if you can't, maybe it's time to invest in a better chair. Remember, you're investing in a better chair, in a better workstation. As mentioned before, people are working 8 to 9 hours at a computer station now. Your chair is going to make a big difference on you. Even the way that your computer is stationed. So the computer monitor that should be at the screen, it should be at the top of the forehead level. So you may have to put some textbooks underneath your computer, underneath your laptop, underneath your desktop. You may have to put some textbooks underneath it to elevate it. Because if we have the computer too low, guess what? We're going to start slouching a little bit. Or you're going to be looking down more, causing a lot of discomfort in that neck and also that low back pain. So make sure that your computer stations, that you are setting yourself up for success, especially if you're going to be sitting there for 8 to 9 hours. I know for me, if I'm sitting there for 8 to 9 hours a day and I'm in a bad position, I'm going to feel it in my low back first. And then after that, I'm going to feel it in my neck. I'm going to feel that tightness, that cramping. And then I'm going to regret that I knew better and I did not adjust my positioning or my posture or my workstation. And I know there's probably so many physical therapists out there that are listening to this right now that are probably adjusting their positioning. Maybe they're looking at their computer stations. They're like, you're right. I have it a little bit too low. I should adjust it right now and take action. You are only going to benefit yourself in fixing that workstation, that ergonomics of yourself. Sometimes your employers, they may not say anything sometimes. They may not even recognize at times. How is somebody going to know if you're having back pain, low back pain, or neck pain, specifically low back pain, if they are not you? You know how you feel. So once you feel that low back pain setting in, you know that you know better. So adjust your positioning, adjust your workstation, and then go succeed at your workplace. Go get it. Go achieve your dreams. Go get your goals. Go do it. Don't hold yourself back. You can do so much in this world. But if you have poor ergonomics at your workstation, you're going to be limited. So, yeah, I think those are big tips to start with.
Thank you so much, David. I must mention and point it out that when you give your answers or insights to the viewers, you're very positive. You radiate a lot of, positivity in the way you're answering, and that's lovely. So we've covered a lot of important things, which includes posture, its a role in preventing back pain. We also spoke about a role of physical activity. Then we did mention about various factors like diet, stress, and sleep patterns, and then we spoke about ergonomics. This is a whole holistic approach, because I think there couldn't be anything better than you addressing these points on this platform, because it literally covers everything that a normal individual needs to know on a very basic level when they're sitting for a prolonged period of time due to their work. So thank you for your insights as a physiotherapist, and it's always a pleasure to meet, physios across the world and come together and have our views shared. So definitely we are missing out on something important, that's about your NPTE final frontier and facts. So I would, request you to speak about NPTE, because we've covered the topic entirely in a holistic manner, and do enlighten the audiences about facts also.
Of course, thank you so much. And I think it's always important to display that positivity and everything because you never know what other people are going through. And you have to keep a positive mental outlook on everything. And you have to be present in that too. So, with the NPTE, that is a licensure examination that you have to take in order to practice within the US. So, with that being said, there's going to be a process to get started for having your, let's say, your transcript reviewed. You may have some deficiencies. So, something that's going to help you out is with the Foreign Academic Credentialing Tools and Services. And that is a nonprofit organization. And for that, what we will do is we will assist you and guide you through consultation, and we will help you get that approval to sit for your NPTE. And if you have any other questions, we would love to assist you with that through that guidance as well. And then for that, you can check us out at faxpt.org, facts.org. And you can find us on social media platforms on Instagram.com/facts.pt. And then also with the NPTE Final Frontier. So that is an organization that is led by the founder, Dr. Bhupinder Singh. He's a PhD instructor, and he started the organization, the company, back in 2015 to help students pass their license examination. And he has been a great support for me. For me, I needed help. I started back in 2017 with Dr. Singh, and I needed help passing my examination just as everybody else does. And ever since then, I've been with NPTE Final Frontier from day one. His loyalty towards me has led to my loyalty to Final Frontier and to every single student globally. So, a lot of the students that are from India, if you need any guidance and support, we would love to help you through this. We have a structured program with a timetable, with full-length practice exams. And what's really nice is that it's an actual class that's conducted over Zoom. I know that there is a time difference between the United States and India, but the beneficial side is that every single class is video recorded. So if it's a little bit too late in the evening or too early in the morning, or maybe you have work or prior obligations, everything is recorded. So you can go back and rewatch it as many times as you want. Classes are also conducted in such a manner where it's through Zoom. So you have a chat box where you can ask questions on anything that you may have questions on and whenever they appear. So with the full length practice exams, that's going to simulate your actual NPTE. And I highly suggest, unfortunately, a lot of people don't take practice exams before sitting for an examination. And I know that a lot of students are also used to taking essay-based questions for examinations. A big difference with the NPTE is that this is going to be multiple choice questions. So it's important to test yourself with multiple choice questions, not essay-based questions. So with NPTE Final Frontier, we will help you with that preparation for your NPTE. And if you have any questions at all, you can check us out at npteff.com and on all social media platforms at npteff. And also, if you're interested in podcasts, I am one of your hosts of the NPTE Final Frontier podcast, where we put out episodes with interviews, but also content and questions that could help you out. And on conclusion, I would like to also share with everybody a quote that I actually really like from Mahatma Gandhi. The future depends on what we do in the present. So, as we were talking about low back pain and taking action, same thing with, let's say, preparing for your NPTE. Taking action. It is important because your future depends on your present. So don't fall into a sedentary lifestyle. Don't allow yourself to stay put. Don't get too comfortable. Get uncomfortable. Force yourself to be uncomfortable. Go pursue every single thing that you want and go do every single thing that you need to do in order to get your goals. Take that action because your present guides your future. And I just wanted to say a big shout out and thank you once again, shukriya, to everybody at the Women's Cell of the Indian Association of Physiotherapists and the entire organization of the Indian Association of Physiotherapists. I really do appreciate your time, your invitation to having me on. I am so thankful, I am honored, and I look forward to next time. Thank you so much, everybody.
Thank you, David. The pleasure was all ours. And on behalf of the whole team, I would extend my gratitude and do visit Mumbai sometime in India whenever you get some time. That's what we're looking forward to. Thank you for your precious time and insights.
Thank you so much. I cannot wait to get to India. I'll definitely be looking up every single person in here to go meet with you. Thank you so much. Have a great day, everybody, and a powerful tomorrow.
Thank you so much.
We'll end the session, ma'am.
We will end with a vote of thanks.
Yeah. So on behalf of IPWC West Mumbai District, I, Dr. Siddhi, West Mumbai District Sub-Coordinator, would like to propose a vote of thanks to all the dignitaries out there. A special thanks to Dr. David Sir for his interactive session for our journeys. A special mention to Dr. Sanjeev Jha Sir, our President of IAP, and Dr. Ruchi Varshney Ma'am, a National Head of IAP Women's Health. I would like to thank Dr. Pooja Kamble, our Zonal Head, and really grateful to the entire IPWC Maharashtra State team, Dr. Suvarna Ganveer Ma'am, who's the Maharashtra State Coordinator, for mentoring us in the best ways possible. All the state sub-coordinators, including Dr. Snehal Patel, Dr. Uttara Mohan, Dr. Priya Karange, and Dr. Nirali Sangvi, for always supporting us throughout. I would also like to thank all the participants for their overwhelming response for this webinar. Also, I would like to thank our digital team of the entire IPWC. Last but not the least, I, Dr. Siddhi Gutecha, Mumbai District Sub-Coordinator, would like to thank my team, Dr. Urvi Katakia Ma'am, West Mumbai District Coordinator, Dr. Neha Mishra and Dr. Varsha Chambyal, West Mumbai District Sub-Coordinators, for their unwavering support to make this event a great success. Thank you to one and all once again. Have a great evening.
Thank you, David, for removing your precious time and sharing your insights. I really can't wait to see you in Mumbai. And definitely we'll have a Garba session once you're here. Yes.
Yes, I cannot wait. We are definitely going to dance Garba and have an amazing time.
Absolutely.
Thank you
You
so
have a
much.
great
Namaste and bye. Yes.
you have a great weekend. We'll talk soon.
Sounds like a plan. Thank you, everybody. Have a great one.
Thank you.
Thank
Thank
you,
you so
David.
much.
Bye-bye.
Bye-bye.